Welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is exercise number 6 in the knee exercise program number 2, and this is the final video in this exercise program. So you have made it through all those videos, and just hang in there with me for one more. In this video, I'm going to show you a quad stretch and a hamstring stretch with a twist. I really like these stretches. They're really beneficial. Most of my knee patients are doing this particular stretch as long as they can get in that position and tolerate it. So you're going to assess both legs. So make sure you do that when you go through this exercise with me. I want you to check your good side first, and then you can stop the video if you need to and check your painful side or your bad side, so that you know what the tightness is and the amount of tightness that you have from one side compared to the other. And if you find that, then you're going to work on that. So I definitely want you to include these stretches in your knee program. So let me show you the quad stretch and the hamstring stretch with a twist. This is your starting position for the quad stretch with a twist. Now I'm going to show you on my table here, but this surface is pretty high. Most of my patients can only tolerate the surface at home, like a kitchen chair, the seat of a kitchen chair, maybe their couch or ottoman. Those are pretty common surfaces that people tell me that they use. So for this one, you're going to face away from whatever surface your foot is resting on. Right? And the first movement, besides putting your foot up here, is to lean back like that. So doing like a back bend. And you want to lean back until you feel even more of a stretch in that quad. For a lot of my patients, just putting that leg up behind them, even on a kitchen chair, it gives them quite a bit of stretch. And sometimes they can barely lean back before it's so much of a stretch that, that's all that they can tolerate. And that's fine for now. Remember, you're going to test your good leg first and then your bad leg, so you can see what normal is for you. And if you're off of normal, if your painful side is not as flexible as your good side, then make sure you do these stretches to try and get it back to what it should be. Another thing I just want to caution or just mention is if you feel like you're unstable at all, have a little bit of a balance issue with having one leg up on something like this, then make sure you do this next to a wall or some surface that's nice and sturdy. Again, a lot of my patients will use a kitchen chair, the seat of a kitchen chair, and they'll just do it by the kitchen table or by the kitchen counter so they have something to hold on to. All right, so back to that quad stretch. So you're going to lean back as far as you can, getting even more of a stretch, a tolerable stretch, but a really good stretch in that quad. And this is where the twist comes in. You're going to twist toward that leg that you're stretching while keeping this backward bent position. You're going to hold this position, if you can, 20 to 30 seconds. All right, again, feeling a really good stretch, but not so much that you can't tolerate it. Then you're going to twist the opposite direction, twist away from that leg, holding that 20 to 30 seconds as well. And that counts as one. So I want you to do 5 to 6 repetitions of this stretch every time you do it. Let me show you the hamstring stretch. So for this one, you're going to be facing the object, so probably your kitchen chair. Again, a lot of my patients will say a kitchen chair works, an ottoman, a piece of furniture like a couch or a chair, or even they can stand at the bottom of a staircase and use the first, second, or third step. That works well too. So you're going to place your foot and heel up on that surface. You want your leg to be nice and straight. Again, if you have a problem with balance, make sure you do that next to something that's sturdy so you can hold on to if you need it. And for this one, you're going to bend forward. So instead of back bending, you're going to bend forward toward that foot as far as you can, fairly comfortably. You want to feel a good stretch in the back of that thigh. So go as far as you can comfortably, feeling that good stretch. And you're going to hold that bent forward position and twist towards your leg, so toward that leg that's up on the surface. Hold that for 20 to 30 seconds. Then you're going to twist away from that leg, holding that position 20 to 30 seconds too. When you do this one, again, I want you to do 5 to 6 repetitions of this one also. And you can do these 2 stretches at least once a day right now. during this program. But if you find that they're helping, and let's see, maybe you're going to go out for a walk or do some kind of activity, and you really like this stretch and you find it's helping, then definitely do it before you go and do an activity. All right, so now you have all the exercises you need for this exercise program, and I hope that you find just that you will have less pain again, and just really get back to doing all those things that you need to do. I asked you to commit to this program for 2 weeks, so remember, at least 2 weeks for this program. If you've had knee pain for a long time, you may need a little bit more time with that first program and with this program too. So don't be surprised if you've had that knee pain a long time. It just might take you a little bit longer. Make sure that you still use ice if you need to. If you're still having some swelling in that knee, make sure you put some ice on that still. That's really helpful. And I just want to encourage you to keep going. You just can't change anything until you get started. And since you've already been doing the knee program number 1, I just want to encourage you to keep going. Just get back to doing everything that you need to do and you want to do. And remember, this is your knee for the future. These knees have to carry you a long time. So the more you take care of them now, the better off you're going to be in the future.